In this presentation, I plan to properly inform on the topic of dialysis, the who, what, when, where, why, how it all works. I currently work in a dialysis facility, and not many people know much about dialysis unless you know someone that's gone through it. I find that it would be beneficial for more people to be educated on the topic because, as the CDC states, kidney disease affects 1 in 7 Americans. Picture this. You're on your way to class, driving down the road, minding your own business. Someone crosses the center line, comes into your lane, causes an accident, hits you head on. You wake up days later in the hospital, you're confused, you're nauseous, your back hurts, you're having trouble breathing, you feel like you have to pee, that pressure's there, but you just can't pee. You speak to the doctor, he runs some tests, he comes back what feels like hours later and tells you that you've succumbed to AKI, which is acute kidney injury, needing dialysis to prompt regeneration of the kidney function. The National Institute of Health states that nearly 242 of every 1,000 people are diagnosed with AKI. Dialysis is a standardized treatment option for many people with kidney failure and AKI, depending on the type of dialysis and their health. There are 2 major types of dialysis, the peritoneal dialysis and hemodialysis. Ross states in 2012 that dialysis is a process that helps your body remove extra fluid and waste products from the blood when the kidneys are not able to. Dialysis was first successfully used in the 1940s and later became a standard treatment option for kidney failure patients starting in the 1970s. When dialysis first started as a possible treatment option, not everyone was deemed a good candidate. The resource that I'm using will further explain. This committee was known as the God Panel. Ross, in 2012, states that the God Panel decided that social worth was one of the acceptable criteria for choosing patients. These patients were deemed fit based on how valuable they were at their jobs, their ability to pay, their civic duties, and their social worth, which really turned out to be as subjective and biased as it sounds. Knowing where it all started lets you know just how far it has come and how it gives access to treatment options to those who could not previously afford it, or those who were deemed unfit to receive treatment based on their social status. In order to receive dialysis now, the patient must be eligible for an access and have an access for treatment. There are 4 types of dialysis accesses that are typically used. There is an arteriovenous fistula, there's an arteriovenous graft, there is a central vein catheter known as a CVC, and there is a peritoneal dialysis catheter, which is inserted into the peritoneum of the stomach. There is hemodialysis, which is typically done in center, and peritoneal dialysis, which is typically done at home in a couple different ways. Hemodialysis is the most common treatment option. It uses a machine that removes blood from the patient's body through one tube, typically out of the arm. If they have a catheter, it comes out of the chest, and it's filtered through a machine, ran through an artificial dialyzer, and then returned into the body from another tube. Most people on dialysis receive it in center 3 times a week. The Cleveland Clinic states that without knowing how it actually happens, it's hard to understand why it can be so difficult for patients and their families. Being someone who is well educated on the topic helps me provide a basic understanding to those who don't know anything about it. Hemodialysis can also be performed at home. With proper training, a patient can cannulate, insert their own needles themselves, and start treatment. There are a number of factors that come into play when starting hemodialysis treatment. It's not as simple as just pressing a button on the machine, pushing go, letting it do its thing. Each machine must be properly programmed correctly for each individual patient. There is probably fairly basic to many renal fellows, but the hemodialysis prescription is an integral part of the nephrologist's routine. Hellman in 2008 states that hemodialysis prescription should specify the following: the dialyzer being used, the time on the machine, the potassium bath, the calcium bath, the blood flow rate, the dialysate flow rate, addressing the possibility of anemia, the possibility of needing IV iron treatments. Most patients will treat for 2 to 4 hours, 2 being someone who's just starting on dialysis, 4 being someone who's trying to get proper clearance. Peritoneal dialysis is slightly different. It uses a catheter inserted into the peritoneum. It's done at home rather than in center. Peritoneal dialysis does not use an artificial kidney or dialyzer. The fluid is inserted into the inner lining of the patient's stomach, called the peritoneum, and then it is later removed and inserted into a bag, flushed down the toilet, dumped down the drain into the septic. Many patients want to do this because it's done from the comfort of their own home on their own time. This provides the patient with an option to live a more normal lifestyle and opens up the option of traveling. Lastly, an important factor would be patient compliance, which refers to how well the patient follows the treatment plan. A factor that is a form of compliance with treatment is infection control. Whether the patient is doing it at home or in center, infection control involves a variety of practices. The National Institutes of Health states the following are very important for prevention to infection. Hand hygiene consists of washing hands with soap and water or using alcohol-based hand sanitizer. Personal protective equipment such as disposable gowns, gloves, masks during patient care. Proper cleaning of the site during dressing changes known as a catheter care. And finally, standard environmental cleaning such as disinfecting equipment, cleaning the machine, the chair, the surfaces that are used during patient care. In 2015, Lineage states that over 3 million people in the world rely on dialysis to live while waiting for a kidney transplant or just to prolong life expectancy. While there are many determining factors, together these paint the picture of dialysis as life-saving but extremely time-consuming, keeping millions alive while science pushes forward to better life-saving measures.